Hey, have you recently been diagnosed with a herniated or a bulging disc in your lower back? I know it sounds scary, but don't panic. I'm here to help you. Keep watching. All right, by popular request, I have put together this little video for those of you that have a herniated disc in your lower back and want to learn how to safely strengthen. Now, it's going to be hard, but this video is going to be a different kind of hard. When we are working on strengthening the deep core to protect our spine, when it comes to bulging discs or chronically injured lower backs, we need to think very, very deep. We need to find muscles that potentially haven't really been working on your side or working at all for a very long time. What we think of when we think of the core is the superficial muscles, the rectus abdominis, the obliques, the internal, external, and the transverse. But I'm here today to tell you that the core involves so much more than that. Basically, your entire spine, from your shoulders to your hips, and the extension of your spine is your limbs. So basically, what I'm saying is your core is your entire body. Having the ability to be able to move our arms and legs while keeping our spine stable is not as easy as one may think. And it's very, very precise work right at the deepest part of the body. What else is at the deepest part of the body? Our lungs and our organs. Can we use our breath to strengthen? Absolutely. Do we need to? Absolutely. Can we strengthen our core without paying attention to our breath? No, not properly. Because our core also controls our breathing. Because inside our core, like I said, is our lungs, but also our diaphragm, which is a large muscle that goes down and up, that sucks air into the lungs and pushes air back up. Now that is the top of your cylinder, and your pelvic floor, also very important in core work, is the bottom of the cylinder. We want to use the top, the bottom, and the sides, as well as the glutes, the shoulders, and everything in the body when we think doing core work. Now, what is a herniated disc? Well, there's about 4 levels of disc bulging, one being just a slight kind of movement of the disc that presses out onto the structures. 2, things get a little bit more exaggerated and it starts to protrude outside the joint space. 3 is when now this disc is really bulging out and now it's pinching other structures. And 4 is when the disc explodes. Now, what level you're at will determine how much you're going to be able to do today and how new is the injury. If this injury just happened yesterday, I don't know if I'm going to recommend you jumping onto this program unless you're at about a 1 or a 2. If you're at a 3 or a 4, I really want you to just go rest easy, take it easy, shoot me a message on Instagram. Let's take care of this right from the ground up. Now, if you had been diagnosed a long time ago and it's become a chronic issue and you just keep flaring it up, then this video is going to help you prevent this from happening again. Okay, so the very first exercise we're going to do today is going to be on our back in this position. I just want you to start by exploring some movements of your lower back. Now, what we're going to do is I just want you to, as long as it's not super uncomfortable, is roll your pelvis forward so you've got a huge arch off of the floor. And then you're going to go the opposite direction where you're going to press every part of your lower back into the ground. See if you can get it there. And then you're going to roll the other way. Now, if rolling while you press your lower back into the floor bothers your back, please discontinue and only go to neutral, which is about here. but you're going to keep rolling all the way through. We're warming up the tissues, but most importantly, what we're doing here is strengthening and stretching the psoas at the spine. We're just going in both directions and make it a smooth, fluid motion, stretching at the end, and then really arching the other way. And we're going to move on to a bridge, but we're going to talk about how to do this properly. So we're going to start with that movement of squeezing the back down, and then I want you to begin to squeeze the pelvic floor before you lift your hips up off of the ground. Now this is going to do two things. Hang out here for a moment. We are now extending through the lumbar spine, which is essentially what we want almost any time we are working on a herniated disc. This is strengthening the backside of the body and the glute, which our glute is supposed to be doing more work than the lower back. It's supposed to be taking more of the movement than the lower back, and it needs to be strong and supportive for that. Furthermore, I know you might be going, okay, put me back down, hang in there if you can, drop down if you need to. Your pelvic floor, the bottom part of the cylinder, when you are squeezing your glutes up, you're probably gonna feel it right in your back end. But then if you further engage your pelvic floor, you will probably notice how everything kicked in the front, lower back, and the deepest part of your core. So we're going to now pair that with a breath. So you're going to inhale as you reach your tailbone away from you and drop down one vertebra at a time. Again, being very mindful and careful if it's hurting you to press your back down to the floor. That's an indicator that you may be a bit too acute still or it's too inflamed and we just need to back off. So now we're going to roll and squeeze, exhale, as we roll the pelvis off of the ground, squeezing the pelvic floor, exhaling hard to activate the diaphragm. And then you're going to inhale, let the pelvic floor go, slowly rolling the back to the floor, one vertebra at a time. We're gonna do that 3 more times. Good, exhale, squeeze up, squeeze the glutes, squeeze the pelvic floor. Begin to squeeze the back, squeeze all your air out. And inhale, begin to take the breath back in, lengthening through your spine, dropping one vertebra down at a time, sacrum, tailbone. And again, exhale up, squeezing like you're wringing out your torso with all those muscles, squeezing all the muscle metabolite out, all that inflammation. And inhale, reach away, create more space. Separate the tissues, relax the tissues, release. And one more time here, squeezing everything, lifting. See if you can get a little bit higher this time. Dig the heels into the ground. Squeeze all that air out and inhale. Now, a side note, when you are working on your breath, it is a lot easier to focus on the exhale, get all the air out, and then naturally your inhale will be deeper rather than focusing on the inhale, not getting all the air out, and then not being able to inhale everything all the way. Make sense? All right, let's move on to our second exercise today, where we're going to move on to our side. Okay, now we're on our side. To most people, this exercise is known as the clamshell. To us therapists, this exercise is known as rotary stabilization of the spine. We're going to take our hand and place it onto our waist. Now you notice how my elbow, I want that directly up to the ceiling. Why are we doing that? Because we want to stabilize the spine and work on the movement of the limbs, or in this case, the hip joint, without our spine moving. So although you're going to feel this in your hip, I want you to pay attention to what's happening in your core, because that is the most important part of this exercise. All right, so your elbow is on your waist, pointing straight to the ceiling. That is going to be your marker to make sure that you aren't taking this movement through your shoulders or back, that you are taking it truly from the hip. You will know if you're taking this movement from the wrong area if your elbow starts to move. Now, you might also notice that if you've done this exercise before, with that kind of elbow cue, you may not be moving as far, and that is totally okay. So let's just do our best in what we can. Start with your knees stacked right on top of one another, and you're going to exhale as you squeeze the leg up and hip open, and inhale as you come back down. Now you're going to exhale again, squeezing your hip, but also squeezing the air out of your body and back down. Now, if it's uncomfortable on your neck, you can place your head back down or onto a pillow. I don't mind having my neck up here, but it could be bothering you. Again, you're going to squeeze up and inhale back down. Now, when I say squeeze, I mean your air out, your belly in, your leg up and back down as you inhale. A few more times here, squeezing up, squeeze, use your core, and inhale back down. Use your core and your breath. Exhale hard, hard, hard. That's gonna help you get a bit more power and strength. Squeeze your pelvic floor and back down again. And let's do 2 more times. Squeeze open, exhale hard, pulling everything in, and down. Good. 1 more time here. Squeeze, earn it, work for it, feel the burn, that different type of burn. Check in while your leg's still up. Where's your belly button? Where's your rib cage? Everything strong? Do you feel it strong and firm in here? That's important too. And back down again. Well done, guys. Let's head over to the other side. Okay, so just like we did on the other side, we are gonna place our hand on our waist, stack the knees on top of one another, keep your feet together, and exhale as you lift up, squeeze open, and inhale as you come back down. Exhale, squeeze up, squeeze open, take it from the hip, use your core is working to stay still, your hips moving to lift the leg, and back down again. Squeeze up, exhale everything, exhale hard, feel how that kicks your pelvic floor into action, and inhale back down again. Good, we got a few more to do here, stay with me, squeeze open, and inhale back down. Good, let's do 3 more. Exhale, squeeze everything in, pelvic floor, diaphragm is working to get that air out, belly button's coming in, and down. Nicely done. 2 more times. Squeeze, and down. And we're gonna do that 1 more time at the very top, squeezing, holding for a moment, check in again. How's everything doing? Is the waist firm? Is the core tight? Everything stacked still. We're working hard to keep ourselves still. There is a lot of strength in stillness, and slowly back down. Well done, guys. We're just gonna move into going face down on the floor. Okay, here we are face down, and I moved my mic over here this time. We're gonna see if that's a little bit better for sound quality, so I'm not breathing directly into the microphone all the time. This first exercise, hopefully you can somewhat see what I'm doing, but I'm going to go right into it. So you're gonna lay onto your stomach, maybe place your forehead onto your hands, whatever is comfortable for you. For purposes of being able to hear me, I am going to lift my chin up just a little bit. Now, all I want you to try and do in this position is lift your belly button off the floor. See if you can find those deep ab muscles. Now you can probably see I'm curling just slightly, and then I'm going to release and relax back down to the floor. So I'm going to use that exhale, exhaling hard, squeezing my pelvic floor, engaging my glutes, and using my ab muscles to lift my belly button up off the floor. And again, back down again. Now there is a tiny little bit of movement. I'm sure you can see it on camera, but it's not much. So this isn't a big movement. This isn't like we're going into a big cat stretch on the floor. We're just activating what's known as the transverse abdominis, which is basically the big round muscle that pulls us in. So squeeze, exhale hard, all your air. Feel how pushing that air out of your body automatically lifts your belly button. Squeeze your pelvic floor and then slowly inhale, fill back up as you release. Let's do 3 more like that. Squeeze, lift, strengthen, squeeze the pelvic floor, squeeze the air out, and inhale back down again. 2 more. Exhale hard, very hard, lots of focus, squeezing everything, finding structures you didn't know were there, and inhale as you release. We're going to do 1 more here. Exhale, squeeze, lift. Try not to squeeze your butt down to get the movement from there. The movement should be coming from the front of your body. Holding your belly button up here, I want you to see if you can inhale while your belly button stays up, and exhale. Notice how restricted that was. 1 more time. And exhale. Good. Holding up at the top. Holding. Release any tension in your glutes and legs. Take this right from the belly button. Lift higher. Find it. Earn it. And release. Well done. Now we're not going to move too far for the next exercise. The next exercise is going to be a combination of what we just did and a little bit of leg movement. So from here, you're going to exhale, pull your belly button up off of the floor, and now see if you can lift your right leg. And then come back down. Now I haven't cued your breath yet. We're going to make this one fluid motion eventually, but right now I just want you to play with this to make sure it's safe for you. So you're going to pull your belly button up off the floor and your left leg, lift it up as high as you can and back down. Now, why are we combining these 2 exercises? Because all too often we will see a leg lift that sacrifices the core stability. Now, in this position, it's not the end of the world, as extension is what we tend to want, but the focus of this video is strength. So let's see if we can combine that now. So on your next exhale, you're going to squeeze your belly button up and at the exact same time, lift your left leg. Keeping in mind, everything should stay super stable, and the only movement you should see is your belly button coming up and the right leg coming up as well. So when you're ready, deep breath in and exhale, lift the belly button, lift the right leg, and inhale, release. Other side, exhale, lift the belly button, lift the left leg, and inhale. Exhale, lift the belly button, lift the right leg. Good, and down. Again, use your breath. Exhale hard, squeezing, lift. Inhale down, fill, expand. Exhale again. Inhale. Exhale, lift and lift. Lots of control. Good. We're going to do 1 more on each side here. Exhale to lift. Inhale, come on back down. Exhale to lift. Inhale, come on back down. Now this next exercise is a little bit more advanced, very healthy for bulging discs, but some of you may need to just stay with the exercise we just did. We got to progress slowly. Rome wasn't built overnight, neither was your core. All right, so you're going to this time curl the belly button under, lift both legs and tap the heels together. Inhale to come back down. So again, your focus is your core first. Exhale strong, lift, squeeze, tap. Inhale, come on back down. Again, exhale, lift the belly, squeeze the glutes. Inhale, come on back down. Let's do 2 more like that. We're going to move on again. Exhale, lift and lift. Inhale, come on back down. One more time. Exhale. Inhale. Nicely done. Now again, if that is where you need to stay, please stay right there as we move on to our third and final exercise in this part of the video. You're now going to squeeze, lift, lift, and we're all going to tap together for 10, 9, 8, keep the belly button up, 6, keep squeezing, 3, 2, 1, and release. Nicely done. Just give yourself a little bit of a rest here. Instinctively, I know that most of you want to go back into a stretch right now. You want to maybe go into a child's pose or stretch out your lower back. Let's refrain for just a moment. Instead of stretching, we're going to use a counter strain. So we're going to move into being up on our elbows here. Now this, again, could be enough for all of you with a bulging disc. And this might be all you need today. How you can take this into a movement is to squeeze your glute and release. And squeeze and release and squeeze down and hold there. All of us are now going to squeeze our glute down, our pelvic floor, keeping that engagement in our belly button like we're pulling it backwards. And now we're going to straighten both elbows and back down. Now, if that causes any pain, shooting, pinching, especially if it's shooting down the leg, discontinue and shoot me a message. Let's talk about it. Same thing, you're going to squeeze as you exhale and inhale. Now, this isn't a stretch, although it probably looks like one, and you may be getting a stretch in the front of your body. What we are doing is we're essentially squishing those bulging discs back to the front of the body. When I said we can move structures back into place, I meant it. We don't always need surgery. Movement is massage. Movement is therapy. Our bodies are designed to move. Our bodies want to move. Our bodies will respond to movement. Squeeze up. Good. And one more time. Take it all the way up. Squeeze, lift. See if you can get a little bit further. You're squeezing your glutes to protect the facet joints of your lower back. Good. Big breath in here. Expand and exhale as you come back down again. So we're just going to change that one up just a tiny little bit and moving into a rotated extension. So instead of lifting both elbows off the ground, you're just simply going to lift one and look in the direction you want to go. Same thing, squeeze the glutes, lift the belly button, rotate, and back down. I don't know if you all heard that. I just got a wonderful little pop out of my lower back that needed to happen. I've been trying to get it to move properly for a few days now. The breath for this movement is going to be exhale as you straighten one arm, look behind you, rotate through the whole spine, and inhale back down. Exhale, squeeze, rotate, use that exhale to strengthen your core, and back down. Let's do two more like that. And back down again, and one more time. And back down. Okay, we're almost done. We are going to move into a couple more exercises. The first one being the standard plank. However, as always, I'm going to show you how to do it my way. All right, so when you think of front plank, we often think, okay, we got to go from our feet and we've got to lift up. And then if we are not strong enough for that, this tends to happen. Now, with the idea of us fixing lower backs with extension, that might not seem like such a bad idea. But remember what I said about the facet joints. So there's another joint at the back of the spine that doesn't necessarily like that movement. So when we train, we want to train in the same position that we want to walk around in. So for today, we're just going to try and protect not only the herniated disc, but our facet joints by keeping both sides of the spine strong at all times. So if you cannot get your belly button up, or you almost see a roundness, a posterior roundness in your spine, and you can't maintain that for 60 seconds, you are simply going to drop your legs down to the ground. There is absolutely no shame at all. Now we're all going to hold together here for 30 seconds, breathing deeply, keeping the belly button strong, just like you were when you were trying to pull it off of the floor. Now at all times, we're not going to lose that engagement. Keep holding, keep breathing, stay strong. You should feel this in your belly button. If you are not by now, go ahead and lift those legs up. Push the floor away from you with your elbows, your shoulders. Squeeze your glutes hard. Keep everything working for you. Breathe. Inhale strong, exhale strong. And 3, 2, 1, and down. Wonderful. We are going to move back to the side body to wrap up this video today. Now, in almost everybody, if you have a bulging disc, I want you to stay with your knee on the ground. We're going to move into a slight side plank. However, it's going to be so precise, I don't want anybody at their feet yet. And the reason for that is because I want this leg inner thigh to be working, as well as the outer thigh of this leg. But most of all, I want your side body to be doing most of the work. So when you're ready, we're going to do 5 on each side here. So you're going to lift up, squeeze. I like to reach my arm up overhead and really focus on getting that waist as high as possible. And back down again. 4 more. Lift up, squeeze, reaching, closing the side body, opening the opposite side, and down. Don't forget about that top foot. Push it down to the ground. Lift, squeeze, activate. Use your exhale. Inhale. Wonderful. 2 more times. Lift, squeeze, reach, squeeze harder. More air out. Inhale. Fill back up with air. 1 more time. Inhale. Lift up, squeezing up, reaching, and slowly back down. Let's head over to the other side. And same thing. Knee down. Top leg is strong. When you're ready, strong exhale, lift up, squeeze the side body, and inhale to come back down again. Doesn't matter if you want to rest for a moment, that's okay. Exhale, squeeze up, rainbow your arm around, and inhale back down again. Nicely done. We got 3 more. That's it, guys. Lift up, reach, squeeze, and inhale. Last 2. Let's hear that exhale. A little bit more, and back down. Up, squeeze, 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 and slowly back down again. Thank you for following along. Here is a review of the 8 exercises from today. For best results, try and do this video 3 times a week for 6 weeks. Make sure you're subscribed to my channel so you don't miss part 2 of the progression of today's video coming very soon. Need a bit more? Try one of my massage at home videos, possibly the one for the lower back. Happy healing!